Ethics and legal issues. So medical ethics, so we have personal and professional ethics. Personal ethics is based on values, ideals, and customs held in high regard by an individual or a group, and they help guide personal behavior and decision making. Ethics in conduct, so we have principles governing the behavior of individuals or groups, which includes professional ethics, which guide conduct in the workplace. So ASCLS has a code of ethics for us in the laboratory, and it is endorsed, obviously, by the ASCLS. It states that all laboratory professionals have a responsibility for proper conduct towards patients, respect and collaboration with their colleagues, upholding the integrity of the profession, responsibility to society at large as well. So the pledge to our profession is it's basically a formal commitment to uphold ethical standards and professional responsibilities. All right, medical legal issues. So we have informed consent. So this is where a patient is made aware of and understands the testing procedure. The patient agrees to the testing and understands how results will be used and reporting. And then we have confidentiality. It's governed by HIPAA, which is the Health Insurance Portability and Accountability Act of 1996. So this basically states all patient information and test results must be kept strictly confidential, and it protects patient privacy and sensitive medical data. HIPAA is a big one. If you guys haven't heard of it, you will. Don't talk about patient anything to anyone unless it pertains to you doing your job, basically. New patient access regulations. So the CMS final rule grants patients direct access to their laboratory test results, and this enhances patient empowerment and transparency. So the lab responsibilities, labs are not required to interpret test results for patients, and patients with questions of their lab results should be referred back to their ordering or treating healthcare provider for explanation and guidance. So even though patients can go onto their patient portal and see their results right away, it usually doesn't say anything about the results. It just has, a number, and sometimes it'll say high, low, anything like that, and it can freak people out, and they can call the lab and be like, what does this mean? We are not advised to, do anything with that information. We are supposed to tell them to call their doctor to get that information, because while we probably know, why their potassium is high or low, we don't know the full picture of the patient, nor do we know why the doctor ordered it. So we are usually just not that person who's going to be doing that type of stuff for our patients. Chain of custody, you'll probably run into these a few times in your lab career. The chain of custody is required for specimens that are involved in medical legal cases. Every step should be documented, and this is started from specimen collection all the way to the transportation, to the analysis and reporting of results. So this is basically a paper chain, if you will, that states exactly where and when and who this specimen has gone through. That way, if anything happens, we can go back and try to trace exactly, what happened. And this helps to ensure evidence is going to be admissible in court by making sure that we have that clear and unbroken record. Some other legal considerations. So healthcare organizations and employees must provide an acceptable standard of care. And that standard of care is the level of care a reasonable person would provide to prevent harm or injury to others.